Hello, everyone. Happy Friday, or if you are watching us on the replay, happy whatever day ending in Y it is that you're joining us. It's Ashley Koff, registered dietitian, and as you know, I'm the CEO of the Better Nutrition program. If this is the first time you're joining us, or if it's your 50th, I just want to remind you that this is an opportunity to bring patients and practitioners together. So we're going to go through the lexicon of better nutrition to make sure we're all using the same terms. We might dive very deeply into an answer, even talk about science, but we'll also come back to making sure that somebody who's never studied science, who maybe is a fabulous musician or teacher or someone, is right there along with us. And remember, if you're watching this on YouTube or you're watching it on the replay on Facebook, do check out the information that I shared with you, because our guest today, which I'm about to jump into, has been extremely generous. She has an amazing 5-day meal plan that is free for PCOS, but we're also going to talk about, in my perception, as I took a look at it, how it might be beneficial for all of us women that are looking to just get a little bit of a jump start on healthy hormones and looking at that lower carb, high protein, just some of those pieces. So without further ado, Melissa Groves, dietitian, is joining us today. And Melissa and I were just chatting, actually, and I thought I would start off here. She and I share a background as second career dietitians, having started off in advertising. So as I look down and not look away from you, but I want to share this on a couple of pages, why don't you tell us a little bit what you were just telling me about how you started off in advertising and what you really found through that experience?
Yeah, so, I lived in New York City. I did my first undergrad at Hofstra University in New York, and then I just stayed in New York. I majored in English and dance, which makes me, super employable. But I ended up working in advertising after I graduated. I really wanted to edit, and so I started as a proofreader, worked my way up through the ranks as a copy editor, and then became a copywriter. And then from that point, the top level that I reached was VP, Associate Creative Director. Wow. At one point. Pretty much the only way I lived with myself, we kind of started talking about this, was the fact that I was working in targeted oncology drugs. So I felt like at least I was helping market drugs that were helping people and were unique and were high science. I really got into the science, and I had never been exposed to that in the past. So that's sort of what happened. I got to about 35 and burnt out. I was working 90-hour weeks. I was traveling globally all over the place. I had launched billion-dollar drugs. So that was when I started to formulate an escape plan from advertising, and had one of those duh moments when I was sitting in my living room and had 4 bookshelves full of food politics books and cookbooks and nutrition books. So that was when I started to think, oh, how hard would this be? So I started taking the prereqs while I was still freelancing in advertising in New York City, and did go back and complete the RD.
Oh, wow. Okay. So, for those that don't know, you went back and you became a dietitian, but you also, and we were just talking about one of the terms that we'll define is DIFM, and we'll talk about integrative and functional medicine. So where did you go from, going to school as a dietitian, and taking those prereqs? And we always are clear about, so a dietitian takes prereqs and then goes and does an internship at a hospital and then can sit for an exam, etc. And so when along that path, or was it later that you started to say, hey, there's nutrition and then there's functional integrative medicine, nutrition, that side of it?
Yeah, it was actually earlier. Way back in 2000, I attended a health coaching school that at the time was a small brick and mortar school in New York City, and now it's a giant behemoth. And at that time, was sort of always attracted to that more natural approach. So, obviously you don't get much of that during your schooling or your internship. So when, after I graduated, and finished the internship, my first job was working in the office of a functional medicine dietitian. So I've just always, it's a lot of self-study when you're interested in functional and integrative medicine. I have to say, joining DIFM, I'm on the board for DIFM, was one of the best decisions I made. They provide so many free opportunities for continuing education that it's just been a really wonderful part of my growth.
Great. So let's go through the lexicon. I always do this if you guys have watched any of our sessions. I want to make sure that before we move forward, there's so many words in nutrition today, like natural or healthy, that are used, and we have all sorts of different definitions. So let's start with, we've mentioned DIFM, we've mentioned integrative functional, and that is you as a practitioner. So let's start with those definitions, and then we'll move on a little bit.
So integrative medicine, in my perspective, incorporates that, sort of more holistic approach where we're talking about sleep and lifestyle and supplements and stress management, but integrates with conventional medicine. So, referrals to other practitioners for testing or medications where necessary, really, really working with the other practitioners. And then functional medicine, what that seeks to do is, instead of treating the symptoms of something, we'll talk more about it, I'm sure, but in terms of PCOS, as opposed to treating with the pill or metformin that's just going to kind of mask those symptoms, we seek to address those root causes that are resulting in those symptoms. So it's a sort of bigger picture view, more holistic. But I also, as a dietitian, it's very, very important to me that everything that I do is evidence-based.
Mm-hmm. And DIFM is then?
Oh, DIFM is it's a dietetic practice group of the Academy of Nutrition and Dietetics. So there's, various groups you can join based on interests. And it's a group of over 5,000 dietitians who are practicing this way.
Yeah.
So,
I think it's so important to know that, because we tend to lump like all doctors together. I get really frustrated when people give the message and say, doctors were never trained in nutrition. I'm like, well, that's actually not true. That's massively changed today. Certainly you have to look generationally, but you also have to look at what somebody has done for themselves. Likewise, health coaches, nutritionists, there are labels that are put, and within the dietetic practice, I too have had just such an incredible experience with what I've learned and the collaboration in DIFM. So I think it's really valuable as people go searching for information. You can connect directly with Melissa, and she can connect you into DIFM if you are a dietitian and you're looking to engage with those resources there, and also to identify dietitians who have had that practice and training. And good for you to know, if you're just a patient consumer, interested, that there are a lot of us dietitians that are focusing on that and really collaborating so that we can share not just what we might read from an evidence-based standpoint, but actually how we're practicing. So these case studies. So we'll get a little more into that because you've shared some really insightful things, but I think important to start there. So in our pre-interview, there was something I found. It is so, like, my heart just opened. I was so excited for this part, where you said when you started off, you had the good fortune of actually starting in a functional medicine dietitian's practice, which is an incredible learning ground, and you're exposed to all of these people. And in particular, a lot of these women were coming in, like so many people who were already investing, right? They were already doing so much right. And in particular, they weren't seeing the weight loss or the body composition results that they wanted to see. And I thought that was so valuable. Your takeaway from that was the hormone piece. And so I'd love for you to pick up here and share a little bit about what that experience was like and what it helped you identify and hone in on from a hormonal standpoint.
Yeah, so I was working with all of the weight loss clients. I think, as dietitians, we know what generally brings people into the office is the weight loss piece. So first of all, identifying that you're not crazy. You're doing a full nutrition assessment, having someone, eating 1,500 calories a day, exercising 5 days a week, and the scale is not budging, the belly fat's not budging. And so, first of all, hearing them and saying, you are doing everything right. You're eating all your veggies, you're exercising, and then validating that through further testing. because there's almost always a reason. Either your insulin is sky high and then you can never lose that weight, or you've got some sort of thyroid dysfunction, you can't lose the weight. With PCOS especially, when your testosterone and other androgens are high, you're not going to be able to lose the weight. So in my opinion, a healthy weight happens as a side effect of wellness. So you've got to get all those systems working, or the weight piece is just not going to fall into place. And I know that's really frustrating for people to hear. And a lot of it is that hard work that, it doesn't sound like hard work, but getting someone to sleep 8 hours a night and getting people to focus on stress management and maybe making some massive changes in their life if it's not supporting their health is really important.
Yeah. And so, Christina, thank you for joining. And Melissa and Christina just had a virtual hug. She's so grateful to be here and to be having this conversation. And that's, certainly why I was so excited when Melissa suggested coming on in this topic. I was like, yes, we've got to talk about this, because so many of the key things that women have encountered, you're addressing. So let's dive into that. One of the things I think is just this myth that's out there is whether it's PCOS, so we'll talk about polycystic ovarian syndrome, which I just think is like horribly named, but we'll get into that one. And also just in general, even things like gestational diabetes or with fertility, this whole notion that it's weight related. So you actually wrote that women will say to you that they feel like PCOS is a lazy fat woman's disease, or, that there's that assumption. And in fact, last night I was sharing with you, I had 2 attendees at a workshop, both of them super fit, healthy, and really frustrated because they've had PCOS for a period of time. And they're just like, is there a way for me to go off of these medications? So let's start with what PCOS actually is. And let's talk a little bit about how, then we'll get into how nutrition can help to address the hormonal components.
Yeah, so as you kind of alluded to, it's a really terrible name, polycystic ovarian syndrome. It leads you to believe that it stems from the ovaries, which is just not the truth. It's actually a really complex metabolic condition that affects almost all of the systems in the body. Currently, the recommendation for diagnosis is using the Rotterdam criteria. So in order to be diagnosed with PCOS, you have to have 2 of the following 3. So you either have to have those polycystic ovaries, which show up as a little string of pearls on the ultrasound. You have to have irregular or absent ovulation or periods. And then the third one is the high androgens, which can be diagnosed either by a blood test or by symptoms. So if you've got that sort of, acne all over your face, you've got some facial hair or hair in other places that you don't necessarily want it. And in the meantime, you're losing hair from your head where you do want it, those can all be signs. So you just have to have 2 of the 3. So it's very possible to have PCOS and not actually have cysts on your ovaries.
And so PCOS being one space, when we look at women and hormonal health across the board, and like Christina, I think it raises a great point here. She said her hormones are such a mess, and that leads her to feeling like such a mess at certain times of the month. And so there are, like, in terms of abnormalities of your cycle, especially in younger women, it's very hard to diagnose. So are there things that even though that's the Rotterdam criteria, are there things like, and I guess the analogy I would give is, if we have celiac disease, which we know is a total allergy to gluten, we have gluten sensitivity and intolerance. So do we have a similar sort of, hey, these things might be going on, but you might not have the PCOS diagnosis?
Yeah, there's definitely some confusion in diagnosis, especially that I see once women are working with a fertility specialist, a reproductive endocrinologist. I mean, I've definitely had patients who are diagnosed with PCOS, but don't really have any of the typical symptoms. And their main symptom is that lack of ovulation. And then when I look, their hormones are low across the board. So it really is hard to distinguish, especially between PCOS and, say, hypothalamic amenorrhea in lean women. There's this lean PCOS, I think, can sort of overlap a lot with that, with the commenter. that sort of stuff can happen more from things like estrogen dominance, which can lead to things like endometriosis. There's a million different ways the hormones can go awry.
Yeah.
So figuring out what's going on
So I'm going to have you pause because I just got an estrogen dominance question mark. So let's discuss. So obviously we have a bunch of hormones, and we always think about women and estrogen. What is estrogen dominance?
So estrogen, it's symptoms from excess estrogen that you're going to feel. It's going to be things like really bad PMS, heavy periods, painful periods, tender breasts before your period. Menstrual migraines is a big one if you're getting headaches right before your period starts. So estrogen dominance can be either from outright high estrogen levels, or it can be normal estrogen, but it's high in comparison to progesterone. Or it could be normal estrogen, but you're detoxing it down a bad pathway that's going to cause symptoms for you. So again, it's one of those things where I feel like my answer to almost everything is it depends. Because we really need to do that more digging and figure out, what's going on for you personally.
Yeah. So let's talk a little bit about how you dig, and I am going to preface all of this. It's so hard for us practitioners when we come on this way because we would work with everyone individually, especially with an integrative functional practitioner who's going to assess who you actually are. And this is the genius of meeting Melissa. So I asked her before she came on. She does virtual consults. She has great information on her social media, but if this starts to resonate with you, your best next step is actually to reach out to her. So just want to make sure you've got that avocadogrovenutrition.com right there, and add that to your to-do list for this weekend or today even. So let's talk a little bit about when someone comes into your office, or even when somebody is connecting with you. Do you have intakes before they even come into your office? How do you start someone on this path of assessment?
Yeah, I always start with a phone call just to make sure that they would be a right fit and that I would be a right fit for them. And if I'm not, I have a wide network of people I'm happy to refer out to someone who may specialize more in whatever you're dealing with. So we start with that. If we move forward, I do a 90-minute initial intake appointment. Usually it takes a couple of weeks to get from the phone call to that appointment. So what I have my clients do is start tracking their food before they work with me, so that then I get a baseline of where they are. I don't do any testing before that first appointment. That first appointment is really where we, do a full functional medicine intake. We go through your whole health history, looking for those triggers, figuring out what's going on. And then we come up with a game plan. Do we need to get your thyroid checked? Do we need to dig deeper into the hormone imbalances? Does your doctor need to rule some things out for us before we can proceed? And come up with food and lifestyle recommendations at that point to get started. Then once we get the information from the testing, that only helps us, tweak and enhance the plan moving forward.
What are some of those aha triggers that you might see in an assessment? So, for example, if I'm looking at a digestive assessment and somebody is smart enough to ask, hey, back when you were young, were you on antibiotics, or were you on antibiotics for your skin, that kind of a thing, that's like a big aha for me. So from a hormone standpoint, what are some of those ahas?
Yeah, history of, I always ask when they started their periods, how were they when they started? Were they regular? Were they always irregular? Did they not get a period until they were 18 or 19? Have they never had a period without medication to stimulate it? So that would give me sort of a baseline. Then I want to know how long they were on hormonal birth control for. What types. I want to know what types of symptoms they have when they do get their periods, because like I said, some of those are really red flags. If I hear that you get migraines the week before your period, it's like ding, 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 Okay, well, I'll need to look at the estrogen. And then from a fertility perspective, do you ovulate? Have you ever gotten pregnant? I do have women who come to me who are in fertility treatments and they've gone through, 7 IUIs and 2 or 3 IVFs and they've never actually gotten pregnant. So something deeper is going on there. If, doing all the things literally and not getting pregnant. So that's going to lead me down the direction of maybe it's an implantation problem. Maybe it's an immune problem. You know, those sort of, everything gives us clues to sort of figure out what's going on.
And what's the role of, so one of the things we're trying to be more careful about these days, probably for our oceans as much as for our health, but is, you know, for example, plastics, right? What's the role of, whether it's mercury or it's bisphosphonates, or what the role of environmental toxins in, from a hormone standpoint?
Yeah, environmental toxins are definitely a large part of what I talk about with my clients, both from a PCOS and a fertility perspective. You know, you're introducing to your body these synthetic hormone disruptors or hormone mimicking agents that have actions in your body. So we do talk a lot about doing the best you can in terms of getting those chemicals out. You know, one of the biggest ones, you know, first off is like never heating anything in plastic. You know, switch over all your storage to glass if possible. And then we start to chip away at, you know, the household cleaners, candles, air fresheners, things like that. Then the skin and beauty products, you know, anything that goes directly on your skin, should obviously be as chemical free as possible. And don't forget your partners when you're talking about fertility. You know, there's definitely exposure in the house, even if you're not personally using it.
Oh, that's awesome. Good. Okay. So, I'm just going to remind the audience, first of all, we're talking with Melissa. We're talking about women's hormone health. And we're going to dive deep into the nutrition piece, which I got like 15 questions to ask you, that people sent in before we even were doing this. Cause, you know, obviously it's a Friday afternoon when we're going live where they're like, I don't know if I can watch it, but she has to answer my question. So there may be a bit of rapid fire at the end. I'm also going to invite, all of you to answer your questions. But I thought I would start off with a discussion. I wrote myself a note on that part about. So let's look at two things. The first one we want to look at is the role of medications and in regulating hormones. So people have asked me to ask you everything from like, should I not do the birth control metformin? Should I, you know, is it an issue if I do hormones to get pregnant? Am I going to have an issue later on? What about hormones? You know, so a lot of questions around the medication side. So how do you address the medication piece as part of the total prescription, for helping a woman get her hormones to where to that place where her body's then able to adjust to and get well?
Yeah, well, you know, as a dietitian, it's not within my scope of practice to make medication recommendations, or suggestions. You know, I will collaborate with the doctor if they want to speak more with me with my recommendations, but it's not my place. So do what your doctor says. Yeah. You know, additionally to that, it's a choice. I just, you know, I've been on birth control. Most of us have been on birth control at some point in our lives. I think what's important is understanding what it does to you and what it does to your body. So the more you know, the more you're able to, you know, prevent those problems. You know, the big myth, and doctors are promoting this, is that birth control pills regulate your hormones. And they don't. They shut down your hormone system entirely. They basically put you into menopause. So your hormone system is not working whatsoever. The hormones that are in birth control are synthetic. They are not the same as the hormones that we make. So you're not getting the benefits. You're not getting the monthly benefits of ovulating, you know, on your bone health, on your anxiety, on your PMS, like, you know, so just understanding that. And the same thing with metformin. It works. It definitely works for insulin sensitivity. It's not without risks in terms of nutrient deficiencies. So, you know, in my opinion with that, you know, when we have something that we have evidence that something works just as well without the side effects, why are more people not using that?
That's great. You mentioned something at the start when we were talking about the different ways with estrogen, and one of them is detoxifying or detoxing estrogen properly. So that could be its whole own discussion when we think about the detoxification system and how that happens. But I'm curious, as you raise the point about birth control, is one factor to consider then if it's a different kind of hormone, or is it detoxed as effectively, or do we need to do things to have it go through the proper detoxification then? So is birth control having an impact on the detoxification of the hormones?
I don't think that birth control per se is going to make your detox worse, but if you're someone who genetically has poor detox pathways, you're not going to deal with that synthetic hormone well. And there's a number of ways we can check that out.
Right.
Looking at some of the nutrigenomics. I'm going to look at some of the SNPs like COMT. And then I use Dutch testing in my practice to see how you're detoxing it. I don't think it's a problem inherently with the birth control itself on your detox, but it can overwhelm an already poor system.
Yeah. And I think, and I wasn't expressing that properly on my end. I think I was more wondering about the synthetic form of the hormone, if that's going to be recognized differently through the detoxification system. But I think your point about, and again, for anyone who is not a practitioner, this is where we got geeky science when we talk about SNPs and Dutch and all this stuff. What we want to understand there is that there are actual tests today that we can understand how the body detoxifies. And it's important because, as Melissa was just mentioning, if you're not detoxifying properly, that could be the root cause. And addressing, how we address that is something that she's able to work on with you. But we'll move on from that one. It's something that popped into my head. I was more just curious about it. And I think the question that I'm presented with is, so I've either been put on birth control and metformin, or birth control alone or metformin, but now, and that worked great for me, as you said, it can work great. But now I'm not in my teens or early 20s, and I want to start thinking about fertility. Can I go off those medications? So totally recognizing a dietitian's job is not to prescribe or medicate. How do you, with your role in helping women with PCOS or who have been on these medications, move into the fertility side? First of all, I think they just want to hear that it's possible to get pregnant and to go through that part. And second of all, sort of how do you look at it? How do you work on that?
Yeah, definitely it's possible. We start to address some of those root causes, the, hormone imbalances, the, poor detoxification and supporting that system, work on supporting insulin sensitivity and reducing the insulin resistance. We work on supporting, lowering inflammation throughout the body. I have had several clients who've been able, working with their doctor, to be closely monitored, to go off metformin, and just stay on a natural path, which is good, and not have their levels change. With the birth control, it's a little different. It depends how long you are on it, how long it's going to take you to sort of regulate. It can take up to a year, 2 years to sort of regulate after coming off birth control. So I always do tell people, if they're thinking about trying to get pregnant, don't say I'm going to go off birth control in January and try to get pregnant in February. It's, likely not going to happen. You need to give your body some time to bounce back.
Is that also a factor too with when you would time then starting to do some of the fertility work? Like, would you say don't waste your money, your time, your effort until you've based on what you're doing with your birth control?
No, I think the earlier that you work with a fertility dietitian, the better. It takes about 3 to 4 months for an egg to mature. Similarly, it takes about 3 months for a sperm to mature. So, as early, any changes that you're going to make to the egg that you ovulate had to have been done 3 to 4 months ago. So you really need to get that set up, earlier. That being said, there's plenty we can do. I work with a lot of clients who say already are in the process of IVF. They already have frozen embryos, but they've maybe had some unsuccessful transfers and are looking to optimize their nutrition prior to their next transfer. So they'll be taking a little break while we're working together. Sort of the horse is already out of the stable at that point. So there's nothing we can do to impact egg quality per se, but we can definitely work on, improving nutrient density in the diet, reducing inflammation, trying to figure out whether there's any of those root causes that are preventing implantation from happening in the first place.
Amazing. So that is the perfect segue into nutrient density, and looking at healthy, promoting a healthy inflammatory response or anti-inflammatory, and looking at that piece. I had, if you can imagine, I'm just going to throw them to you because I know you're going to address them also. I had the litany of questions that were carbs, gluten, dairy, supplements, and I'll come back to them all for you. And then somebody was asking about some particular herbs. So I thought what we would do is, instead of, sort of leading the witness and going into each of those questions, I'd love to talk about really what is optimal or better nutrition for women from a hormonal health standpoint, and then we can go into some of the specific protocols that you found to be effective with different patients.
Yeah, I kind of want to go about it by addressing a couple of them first.
Okay, great. Yeah.
It's a huge, it's just out there. Dr. Google is recommending all sorts of things. I actually on Instagram today, I have a post busting fertility myths. But one of the ones that I say most often is dairy and gluten. And especially for PCOS, when you search PubMed for PCOS plus gluten, literally 0 studies come up. Like, it has not been studied. For dairy, there's some, same thing. There's one small study that comes up, and it was in conjunction with a low carb diet. So who knows? That being said, there's plenty of good evidence that the more fruits and vegetables you eat, that, because you're going to get the antioxidants, you want to really focus on eating the rainbow. So more fruits and vegetables you want, the better. 5 is a minimum. I'd say 8 to 10 is more of a place to shoot for per day. You want your fatty fish, your salmon, your sardines for those omega-3 fatty acids. You want whole grains, but not too many. So, your quinoa, your brown rice. There's a lot of good evidence on, legumes. Anything, basically that Mediterranean style diet, tends to do the best in fertility studies. So that's really, what I recommend overall. Lots of nuts, lots of olive oil, minimize that processed added sugar foods.
And is there anything to the counting? Like, it's very popular right now for people to be like, do you count your macros, or do you balance, or is it low carb in the day? Is it low carb at a point in time? Is it the type of carb? So let's dive into macro carb land. Yeah.
Yeah. So, I know there's a lot of dietitians who specialize in this. I definitely don't. I'm the type of person where if I had to count everything and weigh and measure everything, it would drive me completely insane. I just don't think that's a way to live. I'd rather spend my time doing other things. So I generally use the plate method. So I tell people to fill, at least half your plate with the non-starchy vegetables, keep the starch, which is starchy vegetables or a grain, to the quarter of your plate, and then at least a quarter of your plate to be protein, and then add some healthy fat to that. So, I do have people sometimes spot check, using an app to see where they are. I'll generally do that if I suspect they're not eating enough. We'll do like a 3-day spot check occasionally. So I know that when you're following the plate method, kind of religiously, it ends up being a really balanced macro diet. So it's around, 25 to 30% protein, 30 to 40% carbs, and then the rest fat. So it's literally balanced, when you do it. But I don't make anyone count.
Mm-hmm. And if somebody's following more of a plant-based diet and they're having their grain, let's say they're having quinoa, but also for the protein, do they do that as half the plate, or said differently, what about quinoa and we'll go old school with beans and with grains and beans together? Or can that be too much carbohydrate based on that blend?
I see too much carbs a lot in plant-based people. And I think, they're eating a healthy diet, but what it is grain-based, not vegetable-based. So shifting those proportions and also usually adding more fat will bring it a little more into balance there. I see a lot of brown rice with a little vegetables and a little tofu or a little beans or something like that. And it's, not as balanced as I like to see it. Plant-based, not grain-based.
Oh, that's a great distinction. I really like that part. So be thinking about, and not just the grain, but the starch, not starch-based on that part. I think that part is great. So if you, let's think a little bit about over the last couple of years, some of the big wins that have happened for your patients. And if we can look at them as it relates to maybe some of the myths that are out there, how has somebody, what are some of the things that you're kind of the biggest ones to look out for that then when you correct it, you've seen these wins?
Yeah. So, one of my favorite messages to get from my clients is that they have started to have regular periods again without medications. I love it. Some of them actually call me the period fairy because we'll get off the call and they'll be like, it just started, literally. So I don't know what that is, but I love that. And, we get there by working on balancing the blood sugar, mostly, lowering that inflammation. One thing that I really like about the way that I work with them is that they do that without eliminating any foods. I really don't believe in restriction, especially for PCOS, because it's a lifelong condition. So, the diet recommendations have to be sustainable. And I can't tell you what, your thing is. We all have our thing. Someone's might be chocolate. Mine's, French fries. I'll never turn down a really good French fry. So you can incorporate that into your diet as part of your overall healthy diet. So, the fact that we're able to do that without, making them go off any foods unnecessarily, is really important. And then, obviously my most favorite wins are when clients get pregnant. I had one client who had PCOS and her fertility clinic wouldn't work with her until her BMI was below 40. So we were working on just, balancing her diet, lowering the inflammation. She had she had a realistic timeline in terms of when she thought she'd be able to start with the fertility clinic. And she got her period, and then the next month she got her period, and then the next month she didn't get her period on time, and she was pregnant. Naturally.
Wow.
I was like, I just saved you $30,000.
Yes.
Not winning. But I mean, her doctors were in shock,
Yeah.
Because she'd been going down this road for about, a year and a half with trying to get them to work with her. So the fact that she didn't need to go there was amazing.
Yeah.
And I think she's about 18 weeks now. So.
I love it. I love it. So what's your take on, I'll start from, I look at total nutrition. So as you mentioned, what's going in and on your body, et cetera. And we have this whole world today of fortified foods, some of them great, to be helpful to get in some nutrients that might be really difficult. Some of them synthetic and not so great. And then we have the world of supplements. And so when you're looking at trying to, like in this case of trying to help somebody really help their body run better, what's your toolkit and how do you suggest people, how do you sort of start people on the path of figuring out maybe what they should be getting in versus what they wouldn't be a better source on that part?
Yeah, so I mean that's two of the most common questions I get are what supplements should I take for PCOS and what supplements should I take for fertility? It's really, really individualized. It depends on your diet. It depends on your genes. It depends on your own deficiencies. So in an ideal situation, I'm able to test and get those answers. If I do a micronutrient test on someone and find that they're deficient in B12, then we're going to supplement that. In general, for fertility, you want to be taking a good prenatal that has folate in it, not folic acid, for the most part. In general, you want to be adding a DHA. You want to be looking at some nutrients like choline, vitamin A. Vitamin D is a really important one for fertility. It's very individual. I'll assess someone's diet. If we do have testing, I'll then tweak from there. There's a lot of recommendations on the internet for certain supplements that you should take for fertility. Some of them are dangerous. I would highly, highly recommend testing. I never, ever would recommend, say, DHEA without having hormone levels checked, because that one can actually be dangerous for women with PCOS. It can actually cause more symptoms of PCOS. Just because it's natural doesn't mean it's safe. So
that's great.
Really, really tailor that. I mean, that being said, there are some that are just really hard to get in foods. Or if I get someone who says, "Oh, I never eat seaweed," or "I would never eat seaweed," then then it's like, okay, well, why don't we look at maybe some iodine?
Where are we going to get it from? And I will say to everyone, because we have several more questions. I want to keep us on time. So I'm going to ask a couple more, reminding you, head to Melissa's website, Avocado Grove Nutrition, to get an example of what a meal plan looks like. Go ahead, get her free meal plan. The information is in the show notes. So please check that part out. Somebody asked me when you were saying the B vitamins, I think it's worth just talking about because it's very popular right now, but the methylation, does it need to be methylfolate as opposed to folate? And that was her question on the supplement front.
Yeah, so unless I have, clear evidence that a person does not have an MTHFR mutation at all, and about 50% of us have at least one mutation, then I will recommend a prenatal with folate, just because it's not going to hurt if you don't have the mutation. It's just already in a form that your body can use. There's been some recent research on, what can happen with unmetabolized folic acid in your body. So if you're one of those people who has, you're homozygous which means you have 2 copies of one of the genes, and you're really not able to break down that folic acid as well, I don't want to give folic acid and potentially lead to harm that we don't even know what it could be at this point,
Yeah, I totally concur. And I think I almost have gotten to the point where I don't call the MTHFR, I don't even call it a mutation, because I think we're just at this point where we're like, so most of us just need, and so the methylated form is an easy way. There's no harm to taking methylated folate and certainly there's benefit for, if you have those. So I think that's a great answer on that part. And then somebody else was asking me about, so they're tired all the time. It's common, and asked me about on a spectrum, coffee. So it was caffeine and then sort of stimulant herbs and all of these pieces. So everything from coffee to tea to things like rhodiola. You mentioned DHEA. Do you have someone avoid all of these when they're in the process of trying to get better? She basically said, I know I shouldn't have anything stimulant, but I can't pick my face up. That's my paraphrase. So what do you recommend in terms of those stimulating ingredients, herbs?
Yeah, I never recommend anything that I wouldn't do myself.
Right.
And you would have to pry the coffee out of my cold, dead hands.
That's right.
So, 1 cup of coffee in the morning, you want to make sure it's all the things, organic, fair trade, shade grown, all that. Keep it to 1 cup. The studies show even when you're trying to conceive, even when you're pregnant, the equivalent in about a 6-ounce cup of coffee is fine. I'm more worried about the chemicals if it's not an organic coffee. So I don't really believe in eliminating anything at all. It's about balance. Little green tea, little coffee. Green tea is great for detox too. It helps your liver detox your estrogen. So
I think you've made quite a few people happy. I would add to that I think your point about the toxins is so critically important, and especially when you get into some of the stimulant herbs and herbal supplements. I think your point about coffee and tea is incredible. I'd be a little bit more nervous as you move into some of those others. So I think you're spot on. It's really about the quality and what else you might be getting in, right?
Exactly. And coffee's got antioxidants and, there's all sorts of great research that coffee is actually good for you in certain ways. I think the problem is too much of any one thing is not a good thing. I've definitely been there. I remember doing a nutrition assessment on myself and I was like, I only drink 3 cups a day. That's not much, but there are 3 24-ounce cups of coffee. That's
That's right.
a gallon of coffee I was drinking. So then it was like, okay, well, maybe we need to step back a little bit.
Oh, Melissa, thank you so much. For everyone, please, head over to Avocado Grove Nutrition. Also, one of my favorite new pastimes is her Instagram. It's really fun. The way you're presenting the information is fantastic. So, I hope that people will do that and also check out your meal plan. And as I mentioned at the start or midway through, I can't quite remember, Melissa also does see patients virtually. So, if any of the information here sounded generic, first of all, it was very focused. I don't think that. But I really applaud her for answering. We can't be specific. And so, if you want specific help from her, you have to actually connect with her to get it specifically. So, thank you so much. And, I really hope that we can connect more in the future. Super excited for our network to, get to know you and other practitioners. If you are watching, Melissa, also connect with Melissa or consider grabbing that meal plan just so that you can have a sense of something she's putting into practice, which is effective. So thank you.
Thank you.
Awesome.